IOE 413 Healthcare Quality Study Guide. This problem is about risk adjustment of healthcare outcomes. Risk adjustment is something that's of great concern right now because CMS and other payers are linking risk-adjusted outcomes with payment. This problem wants you to compute the probability of readmission using a risk adjustment model based on logistic regression. The coefficients for the logistic regression model are shown below. Let's assume that there was some data set that a statistician used to fit a logistic regression model that's described by these parameters. And what the question wants you to do is compute the probability of readmission for a hypothetical patient having the following characteristics. The patient is 55 years old, is male. For the primary procedure was in the hospital for 3 days, so length of stay was 3 days. And the patient has 5 chronic health conditions. So the way we would approach that with this model, alpha, as you'll recall from the lecture notes, is a constant in the model. And then beta 1 is the age, okay? And so for our hypothetical, we'll say x1 is equal to 55 years old. And then there's sex, and the way it's coded here is 0 is male, 1 is female. The patient of interest is male, so x sub 2 is 0. And then x sub 3, which is the length of stay, we said was 3 days. And the number of chronic conditions, x sub 4, we said was 5. There are 5 chronic conditions. This is a fairly sick person. And age squared, of course, is x sub 5 is just x sub 1 squared, 55 squared, which is 3025. And then to compute the probability of readmission from the logistic regression model, we just use this expression down below where we plug in alpha and beta 1 and x1 and beta 2 and x2, etc., 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 down to beta 5, x5. And you'll notice when we exponentiate this, that's the numerator. Then down below, the second term in the denominator is just the same as the numerator, so it's the same thing. We plug all of our alphas, betas, and x's in, and when you compute that, p ends up being 0.073 or 7.3% chance of a readmission within 30 days for this hypothetical patient.